ಅನ್ಸಲ್ಲ ಏನು.
ಹೇಗಿತ್ತು ಹೇಳೋ ಇಲ್ಲಿ 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 ನೋಡಿ ಇಲ್ಲಿ ಬಾ ಇಲ್ಲಿ ಬಾ ಇಲ್ಲಿ ಬಾ ಇಲ್ಲಿ ಹೇಳೋ ಸೀದಾ
So today we will know the most important topic and very crucial for our CKD patients is nutrition. So as most of the patients who come to me with a renal failure, they will ask me, sir, what diet to eat so that my kidney failure completely reverses. There is no diet which reverses your kidney function. So there is no food which reverses the kidney. There is no food which reverses the kidney size. So this is very important. So what is the diet which we have to follow? It depends on the various stage of CKD. We can divide into early stage and later stage of CKD. So early stage is CKD stage 1, stage 2, stage 3 when the GFR is between 90 to 30, and stage 4 and 5 is when GFR is between 13 to lowest 0. So when the advanced CKD stage, that is the patient has to be on low potassium renal diet. So all the food contains potassium, like few foods contains more potassium, like fruits, tender coconut water, dry fruits, all this contains more potassium. So we try to restrict it. The most important thing is we have to keep on monitoring the potassium, because not all the patients are hyperkalemia, but few patients are prone for hyperkalemia. In this, every month getting a potassium is a must in a CKD stage 4 and stage 5. Second, phosphorus. So we have to remember 3 P's: potassium, phosphorus and proteins. When we concentrate on these 3 things, I think 90% of diet in CKD is already structured. See, after the stage 3 of CKD, the phosphorus gets built up in the body, and this high phosphorus along with the low calcium, there is a calcium phosphorus product which can get chelated in the tissues as well as blood vessels, causing cardiovascular diseases. So we try to reduce the phosphorus level. How we reduce? One is by diet, second is by medications. So what diet? So the few diets are high for phosphorus, like dairy products, red meat, canned foods, all packed foods contains high phosphorus level. So we try to reduce that colas, better to stop the colas and reduce the red meat. In spite of dietary control, if the patient still has hyperphosphatemia, then we add phosphate binders. Is very important, that is the protein intake. So people go both extreme. They either take high protein diet, some herbal proteins, those who are having diabetic with diabetic nephropathy. Some they go very extreme and they stop all the proteins, so that the patient come with a malnutrition. So what we suggest is a balanced diet. A balanced diet, how we call it as a balanced diet. So stage 4 and 5 we advise protein intake of 0.6 to 0.8 grams per kg per day of protein intake. So what are the proteins? High quality proteins are preferred, like chicken breast, whey proteins, fish. But if patients is a vegetarian, then we advise them tofu, dal, lentils. All this also contains proteins, but they are not high biological containing protein. So this is about protein intake. What about stage 1 to stage 3? Here we advise protein intake of 0.8 to 1 gram per kg per day. This is about CKD not on dialysis. But once the patient is initiated on dialysis, then the protein intake has to go up as much as 1.2 grams per kg per day. Say a patient of 60 kgs, then the patient has to take around 72 grams of proteins. Whole egg contains 6 grams of proteins. If you just take egg white, it contains around 3.6 grams of proteins. So just imagine the patient has to eat about 10 eggs per day to achieve that amount of protein. But what we suggest is, say around 4 to 5 egg, 2 complete egg and 3 egg whites, combined along with this whey proteins supplements, along with the high protein vegetarian diet. That's how they can achieve a high protein, appropriate protein intake in a CKD on dialysis. This is very important. So many patients come to me, they tell, sir, I am losing weight. The most important cause for losing weight is they are not taking adequate diet, and or the patient is not taking adequate calories. These are the two most common cause, 95% cause for loss of weight in CKD on dialysis. So this is about a protein intake. So what about the calories? How much calories they have to take? The calories for all CKD patients, just keep it around 35 kilocalories per kg per day. So vitamins, especially on dialysis, vitamin supplements are important, because the water soluble vitamins are lost in dialysis. So we supplement water soluble vitamins like folic acid, vitamin B12 occasionally to the patients in dialysis, and keep monitoring once in a year at least vitamin B12 and folic acid level. This is about vitamins. I think this is